know that this session is being recorded. Everyone will be on mute. You can listen through your telephone if your speakers are not clear enough for you. There are phone numbers. You can go to the audio section and switch. And as I mentioned, if you'll introduce yourself in the chat, that'd be great, so we know who's in attendance today. We have a separate Q&A box where you can put in your questions as we go through the presentation, and we will get those answered at the end. We've left time. We'll also send a copy of the PowerPoint in a PDF document after the webinar, so you'll have that on hand, and any links that are in that the PowerPoint will be active in your in your PDF. So I'd like to get us started. As I mentioned, we are Action for Healthy Kids. We were formed 20 years ago last year when Dr. David Satcher mentioned or sent out a report that said we have an obesity epidemic, and convened teams from all over the US to meet in Washington, DC and talk about how they could make changes happen in schools. So we have been working in schools around policies, around school meals, nutrition, physical activity, more recently around social emotional health. And we'll continue to move forward in those areas as Action for Healthy Kids grows. We have resources around all of those topics. We offer webinars and trainings on a national basis and tip sheets on different topics as well. And just so you know, those of you, if you're in a small or rural district, we have just started a cooperative agreement with USDA and announced we're going to be providing grants to rural and small school districts. So you'll find more information on this on our website. There's a webinar actually this afternoon at, I believe it's at 2:30 or 3:30 to learn more, and the applications will be opening April 10th. They will be closing on May 26th. The plan is that those grants will be awarded this summer, so you'll have funding, and each district grant is up to $150,000. So we're very excited about this and hope that some of you on the call today will be able to apply. Today we have with us, I'm excited to introduce Brandi Bowlen, who is on our state steering committee, and she is with Region 4, and Lisa Sicilio,
yes,
who is with Region 6. And I'm going to turn this over to Brandi, who is going to share a little bit more information.
awesome. Thank you so much, Michelle. How wonderful it is to get to work with Texas Action for Healthy Kids. We're all on the same page when it comes to the kiddos in the state of Texas and how their health relates to their education. So I'm super happy to be here with you today. So good morning, everyone. Like Michelle said, I am Brandi Bowlen. I'm the school health specialist here for the Region 4 Education Service Center in Houston, Texas. Previously, I was a school nurse in Klein ISD for 12 years. So hey to my Klein ISD family out there. I am here with Lisa, my colleague, to talk to you guys about something so critical to the success of our youth in Texas. School nurses are an essential part of our campus staff. They take care of our children's health in so many different ways, which directly impacts their readiness to learn. But many schools do not have school nurse or may only have one on certain days of the week. This morning, we will talk about what the role of a school nurse really looks like, because it's, quite frankly, very misunderstood, and how you can make sure that children in Texas have access to the care of a school nurse. Lisa Sicilio currently serves as school nursing specialist for the Region 6 Education Service Center in Huntsville, Texas. In the 28 years prior, Lisa served as a campus nurse in College Station ISD, with 18 of those years including nursing coordinator responsibilities. This is her 42nd year as a registered nurse with experience in NICU nursing, pediatric home health, and school nursing. I got trapped by the 42, Lisa. That's just so amazing.
I know. I'm only 42. Yeah.
Lisa is a nationally certified school nurse with a Bachelor of Science in Nursing from Roberts Wesleyan College in Rochester, New York, and a Master of Education in School Nurse Education from Cambridge College in Cambridge, Massachusetts. She served 14 years on the Texas School Nurse Organization Executive Committee, including the position of Professional Development Chair, President-elect, and President. Lisa was in so many ways a mentor to me as I grew up in school nursing and in school health leadership. So please help me in giving her a very warm welcome. Lisa?
Okay, well, we need to start at the beginning. Okay, there we are. Okay, well, we can go to the next slide. Thank you, Brandi, for that wonderful introduction. Whenever I talk about what school nurses do, I always like to start with the definition that the National Association of School Boards, School Nurses approved back in 2017. It's a very comprehensive definition, and I'm not going to read it word for word. If you're not familiar with it, you can scan it as I continue on. As I said, it is very comprehensive, but I have been drawn to that area in bold for many years now, that school nurses are the leaders who bridge healthcare and education. And we require a comprehensive knowledge of both the nursing world and the education world, and often have to learn that education language so that we are able to more effectively advocate for the students in our care. So the bridge that we provide, since that is part of my title, the bridge that we provide is part of the how of our practice. And if you're not a school nurse, and you may wonder, what do school nurses do every day? And even if you are a school nurse, I know that you've got many stories to add to this. So I just want to give those of you who may not know what we do just a little idea, a little glimpse into our world. Next slide. So somewhere in Texas, a kindergartner needs assistance with daily catheterization due to spina bifida. A first grader with no history of seizures collapses during PE and is having a grand mal seizure. A second grader runs into the gym wall and fractures both wrists. A third grader has been coming to see you every day with a stomach ache at recess, and it turns out he's being bullied. A fourth grader has missed 25 days of school due to uncontrolled asthma. A fifth grader comes in with headaches every day. They're losing weight, they're thirsty all the time, and they're very tired. The nurse communicates their concerns to the parent, and a diagnosis of diabetes was made. A sixth grader attempted a backflip from the bathroom sink and fell on his head. There was bleeding and vomiting. He went to the ER and he was diagnosed with a skull fracture. A seventh grader is struggling with the side effects of chemotherapy, but desperately wants to be in school. An eighth grader with cystic fibrosis requires monthly infusion of antibiotics through a PICC line. A ninth grade student is heard making herself vomit in the bathroom, and she appears to be losing weight. An athlete comes in with racing heart rate and having chest pain. He has been consuming multiple energy drinks every morning. A 10th grader is pregnant and is scared to tell her parents. An 11th grader complains of ankle pain and is being treated for a sprained ankle, but when the nurse assesses it, the area is hot and tender with red streaks. So the nurse makes an urgent referral, and the doctor begins treatment for MRSA. The nurse is called to the restroom where a student has been found with a razor blade laceration to the wrist. A teacher comes in with severe chest pain and requires emergency medical care. These stories are based on real situation and multiplied 100-fold across Texas. Next slide. We're often asked about what's a typical day like in school nursing, but there are no typical days in school nursing. A day might include dozens, maybe even 100 doses of medication, nursing assessments on everyone who comes through that door, from minor first aid to severe trauma, management of chronic conditions such as diabetes, asthma, seizures, brittle bone disease, cystic fibrosis, dysautonomia, and more. Treatments including nebulizer treatments and care of burn wounds, catheterizations and tube feedings, vision, hearing, and spinal screening, immunization compliance surveillance, developing healthcare plans, securing resources for glasses or hearing aids, staying current on legal issues, implementing employee wellness programs, health education for faculty and students, promoting a healthy school environment, phone calls to parents, 504 meetings, medical emergencies, including anaphylaxis, opioid overdose, sudden cardiac arrest, fractures, and any emergency you can think of, SHAC meetings, health presentations to faculty. The list goes on. Are we exhausted yet? Next slide. Many years ago, Jocelyn Elders, who served as Surgeon General of the United States from 93 to 94, said, "You can't educate a child who isn't healthy, and you can't keep a child healthy who isn't educated." And this is something that stuck with me at the beginning of my school nursing career. And it just points to the position that school nurses are in a vital position to bridge the gap between healthcare and education. And while it would take hours and hours to tell all of you all of the components that we do every day at school, trying to multitask and do it all, we're just going to hit on 3 areas that you see on the screen. Next slide. So believe it or not, schools are optimal places for the spread of disease. And it is critical to prevent diseases from taking hold in our student population. So school nurses do use many practices to keep schools healthy and disease-free. One of the first things that I encourage nurses to do is document of every clinic visit, because documentation is early to detection of emerging disease trends. We also ensure vaccination compliance, and this is truly important to help the majority of our population gain immunity to vaccine preventable diseases such as polio and measles. School nurses can also help limit the spread of disease by teaching student hygiene best practices, such as proper hand washing techniques. And this increased so greatly during the COVID pandemic when we were working with custodial staff and PPE, and the fact that we couldn't give nebulizer treatments because of airborne disease. So school nurses are at the forefront of disease prevention. We also remove barriers to learning by conducting these in-school screenings. And remember what Jocelyn Elders said, relates to vision and hearing issues, and these can greatly impact a student's ability to learn. And so vision and hearing issues are seen as health issues. The nurses also educate students, families, and staff on topics of health and demonstrate techniques to aid in well-being. We also work with child nutrition in the physical ed department to promote nutritious meals and active students, which can result in healthier school environments. Next slide, please. And all throughout our code of ethics and scope and standards of practice, we are provided with obligations and duties that are non-negotiable. To provide the best care to individual students, school nurses must be aware of student cultural diversity. No 2 students are alike, and the factors listed on the slide can influence our cultural norms and related healthcare preferences and expectations. Everything in a child's world makes an impact on each student's needs. Culturally competent school nurses take these elements into consideration when determining how to best communicate with students and their families. By showing care and respect, nurses can interact with students and their families effectively and help build healthier communities. In addition, school nurses must be aware of their own cultural competency and assess their level of understanding. There's always room to learn so that we can provide more effective care. Next slide. There we go. So many families don't have access to medical services for one of the following reasons. With geographic limitations, especially in rural areas, there are very limited healthcare options, and transportation issues may contribute to access to care. Also, when we look at the high price of insurance that limits some families from being able to afford medical insurance, a family may not be able to take off time from work in order to take their child to an appointment or stay at home with them when the child is ill. And one huge issue are students without legal citizenship. Our immigrant population, they may be deterred from seeking health care due to difficulty receiving coverage. Undocumented immigrants only qualify for emergency Medicaid, and permanent residents have to be a U.S. resident for 5 years before qualifying for Medicaid. So these policies create gaps in coverage, making it impossible for some of our students to qualify and prevents many families from seeking health care. Next slide. There we go. So I heard Brandi talk about misunderstandings and everything about school nursing, and we hear it all the time. There are assumptions about school nursing that focus on things like ice packs, checking for lice and Band-Aids, and this often causes nurses' work to be misunderstood and devalued. However, the World Health Organization has found that schools are one of the most consistent and appropriate locations to address young people's health needs. School nurses provide a strong return on investment, especially in areas of immunization and management of chronic health conditions. These are just some of the studies that have been done. Schools with nurses has been shown to have a higher immunization compliance, resulting in stronger herd immunity. So fewer vaccine preventable infections are spread to those who cannot be immunized. Fewer students miss valuable learning time, which is our goal. And every dollar spent on immunization saves between $16 and $44. School nurses also help students with chronic health problems better manage their conditions, leading to improved attendance and decreased early dismissal. When a nurse is not on campus and there is no sub, a principal or other educator could spend hours a day dealing with healthcare issues. The calculated cost per school is over $133,000, or $1.84 for every dollar spent on school nursing. Another study found that for every dollar spent on school nursing, $2.20 was saved, and that included the parents' time off from work and cost of treatment. These are just two examples of many from studies that suggest that spending on school nursing ought to be viewed as an investment and not a cost, since the benefits extend beyond the school and into the broader community. Next slide. So the job of a school nurse doesn't just stop at medical treatment. School nurses also fill leadership roles in schools and districts, using their expertise to promote community and public health. They're not only work to improve standards of care at a district level, but they also act as advocates for student safety, helping create policies to address issues such as bullying and school violence. Next slide. So we're going to take a turn and look at some data that has come through from the state of Texas and across the nation. And don't be afraid of data. Data is your friend and can actually help make things better for you. So next slide. This information is from the 2019-2021 snapshot from texas.gov, and also from the nursing workforce reports from the Texas Department of State Health Services. This only shows numbers for the Texas public school system, with over 1,200 school districts and charters, 8,866 campus, 6,242 nurses, and almost 5.5 million students. Next slide. So I really like this slide. This is from the nursing workforce report from the Texas Department of State Health Services. This slide should be linked to where you can go to see all of that information. And just as a historical factor, years ago, NASN recommended that there be a student to nurse ratio, or a nurse to student ratio of 1 to 750. NASN now recommends considering a variety of factors, such as acuity of the students, the social needs of the students, the community and school infrastructure, and the characteristics of the nursing staff. But for the Department of State Health Services, for this infograph, they chose to use that ratio to compare the number of school nurses in counties across Texas. And so remember, this is from 2021. The dark blue shows the number of nurses that take care of 751 or more. I would bet that this number is around 1,000, 1,500, even up to 2,000 or more in some of our high schools. The light blue are areas where counties where school nurses have 750 or fewer kids that they take care of. And the counties in gray had no school nurses reported in that county. And I'm hoping that that's not actually factual, that maybe they just didn't get reported. But this, to me, was an eye-opening. You can look at this and tell exactly where Austin is, Houston is, DFW, and some of the other larger metropolitan areas. Next slide. So we're going to just look at a couple of laws. There are numerous bills that refer to a school nurse or just say nurse when it's referring to nurses in the school system, and usually regarding the task that can be performed. And I am looking forward to the April 13th webinar on what changes will this legislative session have for school health, because there's a lot that can, maybe, and should happen. And so I hope everyone has registered for that as well. Currently, Texas does not require school districts to hire nurses to care for the 5.5 million students attending school. But fortunately, many districts in Texas see the need and the value of adding a nurse to their campuses to care for the increasing health needs of our students. As you can see on the slide, the Texas Administrative Code does define a school nurse as an educator employed to provide full-time nursing and healthcare services, who meets all the requirements to practice as a registered nurse pursuant to the Nursing Practice Act and the rules and regulations relating to professional nurse education, licensure, etc. So at least we have a definition of school nursing. Next slide. So this slide is just a kind of a follow-up on the definition, and just a reiteration that a person may not be employed as a nurse unless they hold a license with the agency that monitors that. And so that would be the Board of Nursing. And what this does say to me, and when I worked as nursing coordinator, every year annually without fail, I ran a license check on all of my nurses in my district. So each employer has an obligation to verify the license through the Board of Nursing of any nurse hired. Next slide. This one is just an example of where they inserted nurse in along with, and usually we are included with librarian and school counselor in many things. This one talks about employment contracts. So when nurses are hired, when registered nurses are hired in schools, they are offered the same professional employment contract as everyone else in this section. So you can go to the next slide. This is from a study done through Child Trends, and the link is there on this slide. I have contacted them because there was one slide, one infographic that showed required, if nurses were required, and Texas was navy blue saying that it was required. And I'm like, where did you get that information? Because I've not ever seen anything in my years as a school nurse that Texas requires schools to hire nurses. However, this one just kind of was a great snapshot. There are states that require nurses to have certain qualifications, and some where they're encouraged, some where it's addressed. Texas does not address qualifications. And just as an example of one state that does, Massachusetts, you can see up in the Northeast, requires a nurse to have a bachelor's degree. And within 5 years, they must either become nationally certified school nurse or obtain a master's degree. And so some of the others have different qualifications. Some of them even have to be certified teachers before they're, or within so many years of being hired. So there are a lot of different qualifications all across the United States. You can go to the next slide. So because there are no requirements for nursing in Texas schools, you're going to see a broad range of nursing licensure being employed by districts. The Texas Board of Nursing is responsible for regulating the practice of nursing within the state of Texas for all of us, for vocational nurses, registered nurses, and advanced practice nurses. These standards establish a minimum acceptable level of practice in any setting for each level of nursing licensure. Failure to meet these standards may result in action against the nurse's license, even if there is no actual harm to a patient. You can find the standards of nursing practice in the Texas Administrative Code, Title 22, Part 11, Chapter 217. The easiest way to find this is by searching for Rule 217.11, and this is the standards of nursing practice. Every single nurse is responsible for knowing his or her legal scope of practice. It's also probably beneficial for administrators and human resources to know the differences in the scope of practice as you are considering hiring and the placement of your nurses. This information could easily fill a whole other webinar, and it does usually for nurses in the nursing jurisprudence session that is offered for nursing for relicensure. But if you need more information on this scope of practice and what that might look like for you, please feel free to contact me. On the following slides, we're going to look at some outcome data from several national surveys that collect data on a routine basis. This one is another one that has been done by the National Association of School Nurses. They do an Every Student Counts every year. This is the most recent results, or maybe they did one during the pandemic, but This one, it didn't seem as complete to me. So this one is from 2019, 2020. And this segment of this outcome is just showing the health office visit by outcomes of return to class, sent home, or 911 called. And you can see that visits are not equal among professionals. Nearly every year, or pretty consistently, the return to class by registered nurses is higher percentage, and sent home is usually lower. And that data can go a long way in showing the impact that your school nurses make. And after all, our goal is to keep the students in the classroom learning if possible. The next slide, please. This is another National Association of School Nurses survey workforce study. This one is from 2018, and I chose this one as an example. You can click the link on the slide when you get it to look at more of the infographic data results from these workforce studies. But this showed a good representation of several areas that I wanted to show you. The map of the United States shows Texas and other southern states in dark blue. And what this means is that in this area of the United States, that there are the nurses that are hired in schools, 60.8% of them are full-time, 14.5% of them are part-time, 24.7% of them have no nurse in their school. If you look down in the lower left hand, there's an education and age demographic. I just wanted to draw your attention to the ages, the average age of school nurses. I'm combining the ages, the last two, I believe. So about 48% of school nurses are 50 and older, which is a concern as we look to the future and who will be caring for the students of Texas. So you can also find all of this information at nasn.org, NASN.org under the research tab, and you can look for both the Every Student Counts and the workforce studies. Next slide. So we're going to put our focus back on students for just a few minutes, as they are the center of everything that we do. So why is it vital that schools have nurses providing care for the students that we serve? There has been a consistent, steady increase of students entering schools with medical conditions, including those with complex needs. This includes students with underlying conditions that may be regarded as chronically ill, medically complex, medically fragile, or nursing dependent. Students with chronic health issues and those who have acute crises and complex needs are likely to require the support from a licensed registered nurse. Next slide. This is also a part of an infographic from the Every Student Counts 2018-2019, where it shows these are usually, when we're talking about chronic health conditions, people usually refer to asthma, diabetes, seizures, and anaphylaxis. So this is just a showing you how many students per 1,000. And you may think, oh, that's no big deal, but let's put this in perspective. Say we have a middle school with 1,500 students and 1 RN. The nurse could be providing care for an average of about 150 students with asthma, 8 students with type 1 diabetes, 15 students with seizures, and 55 students with a life-threatening allergy needing EpiPen. These numbers fluctuate every year. And remember, these are not the only 4 categories of chronic health conditions that school nurses deal with, nor the only thing that they do during the day. Next slide. Hopefully you can see this one. This is a child health data from the National Survey for Children's Health. And this one is 2 years combined of 2018 and 2019. And this has, if you go to this, and I believe that the image is linked, that you can go and look at these. The childhealthdata.org is where I got this. But you can look up pretty much any indicators, and this one is just an indicator for obesity in our children in Texas. Well, this is nationwide, but I'm going to look at Texas. Ages 10 to 17 who are obese. And this is the BMI above the 95th percentile. The range across the states is from 9.6 to 23.8, and 17.3 of our children in Texas met that criteria. Being close to the national average is a good start, but let's not celebrate just yet, as childhood obesity can lead to type 2 diabetes, high blood pressure, high cholesterol, cardiac disease, joint pain, breathing problems, and mental health issues that can incur as a result of bullying. Next slide. This last section of an infographic is from the 2020-2021 Health Resources and Services Administration data collection. And this one shows the percentage of children with one or more current lifelong conditions. So I am combining the last two categories, the one that has one current or lifelong condition and two or more, just for the sake of time here. So for children ages 0 to 5, there are 24.5% that have one or more current or lifelong health conditions. When you look at the other two age groups, 6 to 11 and 12 to 17, both categories have more than 41% of with one or more current or lifelong health conditions. So our children, and this is national data, our children are experiencing more health issues, and it is imperative that we have nurses in schools. School nurses provide direct care to students with these needs. They empower students to manage their own chronic conditions and work with students, healthcare providers, school staff, and community to coordinate a student's needs. And at the same time, nurses detect illnesses early, prevent its spread, and identify students at risk, while also advocating for the well-being of the entire school community. Next slide. Oh, I know y'all probably thought, why is she putting a COVID in here? Well, I'm sorry if you're experiencing COVID fatigue. However, it is important to look back and evaluate what we've done in order to improve our strategies as we move forward. You know, when students returned to school in the fall of 2021, the school nurses played a critical role in ensuring the ongoing health and safety of students. And school nurses historically lead efforts to mitigate the spread of communicable diseases, but our role significantly changed over time, and then new COVID-19 responsibilities only added to the school nurses' already full plates. Before the pandemic, you've heard all of the things, the wide range of tasks and responsibilities that school nurses provided. And then when COVID came and the pandemic and when the kids came back to school, the school nurses still had to do all of that. And then they had added responsibilities for administering COVID tests, helping with vaccination clinics, facilitating immunization and health screenings that had been disrupted during remote learning. They also had to conduct contact tracing, enforcing general COVID protocols, dealing with angry parents because we were enforcing general COVID protocols, and providing that COVID-19 education to students, staff, and the families, and doing everything that we always did. And close, go ahead, next slide. So as I'm closing out, a reminder that school nurses are frontline healthcare providers, serving as a bridge between healthcare and education. We are hired by school districts, health departments, or hospitals, and school nurses attend to the physical and mental health of students. We are essential to expanding access to quality healthcare for students, especially considering the increasing number of students with complex healthcare needs. Access to school nurses helps increase health equity for students. And for many children living in or near poverty, the school nurse may be the only healthcare professional that they regularly see. So what can you do to ensure that there's a school nurse on every campus taking care of the 5.5 million students in Texas? That is a tall order, but start locally, start small. If you don't know who is taking care of the children at your school, ask and find out if they're a registered nurse, an LVN, or an aide. If you are an educator or a school nurse, use your district data to establish unique staffing needs for each school. Hire full-time substitutes to fill in the gaps and shift non-nursing tasks to health assistants. Consider ensuring that the professional registered nurse is on the professional pay scale and count their past nursing experience. Consider recognizing a nationally certified school nurse certification as pay incentive. At the state level, get involved in advocacy. Follow bills during legislative sessions that impact school health and thus student health. Contact your representatives when there is a call to action. Our students deserve to have their healthcare needs managed by a professional school nurse. Thank you.
Did you want to mention anything about these resources?
Oh, certainly. I mean, the resources should all be linked, except for some of the codes, but you can certainly take those and Google them. But I have tried to link a lot of the pictures, a lot of the images with the links. So if you need anything, you can certainly contact me. My contact information is on the next slide. Brandi, were there any questions?
We did have one question, and I think I answered it pretty well there in the Q&A section. For anybody who wants to take a look at that, or Lisa, if you have any opinions on that question, you can take a second to look into that. I cannot even thank you enough for sharing your expertise with us today. And it's funny, there's so much great information that so many people just are not aware of, and it's great to shed light on that. So I appreciate you so much. And Michelle, I think we're back to you unless Lisa has anything to add to that question.
Thank you.
Me and my my screen are just challenged today. I think I have cyber gremlins.
That sometimes happens.
Let's see if that works. All right. Thank you so much, Lisa. I learned a lot today, and I have some new ammunition I will be sharing with the legislative aides and people that I work with. I know that there's some bills pending, and like you said, I hope we'll learn a little bit more about what's going on with those on April 13th. So when we send out this PowerPoint and the recording link later this week, you will be able to register for that seminar learning session on April 13th. And we also have another one on May 10th on the importance of outdoor play. And we have our Children in Nature group is going to share, as well as we have one of the University of Texas researchers who's been doing green playgrounds, and he's going to share some data on that. So excited about both of those things. I guess I could show I'm having allergy issues. I'm not sure I want to show my face today. So if you have questions, other questions that may not have been answered, is there anything in the chat? Brandi, did you check chat to make sure?
There appears to be nothing new in the chat.
Okay, so if there aren't any questions, we can give you back a few minutes of your day. And I want to thank you for joining us. I hope that we've given you information that will help you as you move forward with your district and potentially work to get more school nurses, especially those districts that don't have school nurses. That's where I think your school health advisory councils can come into play. I know that our school health advisory council, when I was on the Austin Shack, played a big role in helping determine what type of nursing situation we were going to have. And even though we were partnering with an outside organization, we definitely made our voices heard and the voices of parents who had concerns about their children. There are a lot of children out there that have chronic health conditions, and who are you going to have dealing with that? At one point, I know with no training, the office people were providing medications to children, and those kind of things just, people aren't aware of them. A lot of times parents aren't aware of what's going on in their schools or their districts. And when they find out, they want to do something about it. So if you're a nurse in an area that has few nurses, making parents more aware and visiting with your shack, or however you can, if you're a district employee, I know it's challenging, but getting parents engaged can always help improve the situation. And one of the best ways to do that is through school health advisory councils. So like seeing there's some thank yous in the chat. Okay. Well, thank all of you for joining us today. Hopefully you can join future webinars. Lisa and Brandi, thank you so much for putting this together, and have a great spring. I think we're past the freezes, I hope, because we're planting flowers so that I can sneeze some more. All right, y'all take care.